Let's talk about the metric that most correlates with the hospital's overall rating, and that's our patients' communication with their nurses. When a patient sits down with their HCAHPS survey and they're answering questions on how they communicated with their nurses, they're really going to be answering questions based on just about every communication they had with staff members there at the hospital. The questions they're answering are, were they treated with courtesy and respect? How often were they listened to? And how often did nurses explain things in a way they could understand? The basics are, how well did we listen? How well did we communicate? And did we do it all with courtesy and respect? Again, our patients are answering these questions saying that if communication never happened or if it always happened. Consistency is the key. With the measurement of courtesy and respect, the main idea is to have good communication, and communication that conveys courtesy and respect. A big part of that is eye contact, an open body posture. Even sitting down at the bedside is much more effective than a caregiver who stands up and looks down at a patient. Research even shows that patients feel like they were listened to more and that their questions and concerns were addressed more when a caregiver simply sat down. In addition to courtesy and respect, we want to make sure that we're providing our patients with clear explanations. One of the main things to remember with clear explanations is that the patient decides whether they understood an explanation clearly or not us. So the idea is to minimize any confusing language. So eliminate the jargon that we would normally use from caregiver to caregiver and keep a conversation on their level. But one of the main tactics you can use to make sure that you're explaining clearly is to explain your care as you perform it. That means any function, no matter how simple, whether it's adjusting an IV, moving a call light close to them, you explain why you're doing it. Not just what you're doing, but why you're doing it. It's for safety, it's for their privacy, or so that they can more quickly get in touch with us. If they know why you're doing something, it makes a much bigger impact than you just performing a simple operation. The other side of clear explanations is how well we listen to our patients' responses. Listening to our patients sounds like something that should be second nature, but remember, we want to make sure that our patients feel listened to. And to do that, we can employ a tactic known as active listening. Active listening is simply doing things to make them feel it, nodding your head when they're talking to you, repeating small details, or asking them to clarify a certain point. That's going to let them know that they're being listened to actively and that you're interested and engaged in what they're saying. The main takeaway for all of this, if you can employ one thing to make sure your communication with nurses is effective, is to remember courtesy and respect. Sit down when you're in a room with a patient. Listen actively and use explanations that are free of medical jargon. It makes sure that they know that they're important to us and we see them as more than a patient or just a case number. In our next video, we'll be talking about our communication on medications. And we'll be talking about some statistics that show just how important this metric is to not only patient experience, but to patient safety.